cold feet, numbness, heavy steps. Is this the fate of growing old? Or have you just not discovered this yet? Do you often feel a chilling cold in your feet, even when the weather isn't freezing? Do your fingers and toes frequently tingle or feel numb for no clear reason? Or does every step feel heavy, leaving you exhausted despite not having done strenuous work? If you are over 60, you may have been told, that's just a normal part of aging. But I'm here to tell you, that is not an inevitable fate. It is often a sign of a condition that can be improved. Poor blood circulation. And the amazing thing is, the solution may not lie in expensive medications or complex therapies, but simply in familiar, easy to find, and powerful beverages that you can start enjoying today. With just a small change to your daily drinking habits, you could feel a noticeable difference in less than 24 hours. Are you ready to discover this secret to transforming heavy legs into light, energized steps? Aging brings many changes to the body, and one of the most critical, yet often overlooked, is the decline of the circulatory system. For seniors, poor circulation doesn't just cause daily discomforts like cold hands and feet or numbness. It also carries potential risks for more serious health issues, such as stroke, cardiovascular disease, or peripheral artery disease, PAD. However, the good news is that you are not entirely powerless against this natural progression. In fact, several natural, nutrient-rich beverages can play a powerful role in improving blood flow, bringing new vitality to your legs and your entire body. The circulatory system is the body's transport network, responsible for delivering oxygen and nutrients to every cell and carrying waste products away. As we age, blood vessels tend to become less elastic, narrow due to plaque buildup, atherosclerosis, and the heart may work less efficiently. This leads to numbness and tingling, especially in hands and feet, because nerves are not receiving enough oxygen. Cold extremities show insufficient blood flow to warm the limbs. Swelling, edema. Blood and fluid don't circulate well and accumulate in the lower limbs. Fatigue, shortness of breath. The heart works harder and organs don't get enough oxygen. Slower wound healing. Cells don't receive enough nutrients to regenerate. Increased risk of cardiovascular disease and stroke due to blockages in brain or heart vessels. Interactive question. 1. What signs of poor circulation do you notice in your daily life? Share a specific experience that you think might be related to this issue. You don't need to search far. The following beverages can become your close friends on your journey to better circulation. 1. Water. The indispensable foundation. It sounds simple, but water is the most critical element. Our blood is about 92% water. When the body is dehydrated, the blood thickens, making it harder to flow through tiny blood vessels. Benefits. Ensures blood maintains optimal viscosity, helping the heart pump blood more easily. Supports kidney and liver function, indirectly improving circulation. Usage. Drink 8 to 10 glasses of water daily, even if you don't feel thirsty. Seniors often have a reduced sense of thirst, so set a routine goal for water intake. Note, avoid dehydrating beverages like excessive coffee or sugary sodas. 2. Green tea. Green tea is famous for its high content of antioxidants, especially EGCG, epigallocatechin galate. Benefits. EGCG helps dilate blood vessels, improves endothelial function, the lining of the blood vessels, and reduces inflammation. It also helps prevent plaque formation in the arteries, lowering the risk of atherosclerosis. Usage. 1 to 3 cups of green tea per day. Avoid drinking too close to main meals, as it can interfere with iron absorption. Note: green tea contains caffeine. If you are sensitive, choose a decaf version or consume it in the morning. 3. Ginger tea. Ginger is a powerful spice and herb used for thousands of years in traditional medicine. Benefits: ginger contains gingerols and shogaols, compounds that have anti-inflammatory effects, warm the body, and improve blood flow by dilating blood vessels. It can also help lower bad cholesterol and prevent blood clotting. Usage: brew fresh ginger tea, slice and boil ginger, or use ginger tea bags. Drink 1 to 2 cups daily. Note: ginger can interact with blood-thinning medications. Consult your doctor if you are taking these drugs. 4. Beetroot juice. Beetroot is a superfood for cardiovascular health. Benefits: rich in nitrates, which are converted into nitric oxide, NO, in the body. Nitric oxide is a potent natural vasodilator, helping to widen blood vessels, lower blood pressure, and increase blood flow to organs and extremities. Usage: drink a small glass, about 100–200 milliliters, of fresh beetroot juice daily. You can dilute it with water or combine it with other fruits. Note: beetroot juice can turn urine and stools red, which is normal and harmless. 5. Pure cacao, dark chocolate drink. This is not hot chocolate milk or regular chocolate. We are talking about unsweetened, pure cacao powder. Benefits: cacao is rich in flavonols, a type of antioxidant proven to improve endothelial function, dilate blood vessels, and boost blood flow. Flavonols also help lower blood pressure and improve artery elasticity. Usage: mix 1 to 2 teaspoons of unsweetened pure cacao powder into warm water or a plant-based milk, like almond milk. Note: choose pure, high flavonol cacao. Avoid sugary milk chocolate products. 6. Pomegranate juice. Pomegranate is a fruit packed with antioxidants. Benefits: pomegranate juice contains powerful polyphenols that help protect blood vessels from damage, reduce inflammation, and improve blood flow. Studies suggest it can help lower blood pressure and prevent plaque buildup in the arteries. Usage: drink 1 glass of 100% pure pomegranate juice daily. Note: choose 100% pure juice with no added sugars. 7. Peppermint tea benefits. Peppermint contains menthol, a substance that has vasodilating effects and helps relax vascular smooth muscle. It also has anti-inflammatory properties and can help reduce the feeling of heaviness in the legs. The fresh taste of peppermint also helps boost mental alertness. Usage: drink 1–2 cups of peppermint tea daily. Note: peppermint tea is generally safe, but those with acid reflux issues may need to limit consumption. Interactive question 2. Of the drinks listed above, which one are you most excited to try, and why? Would you be willing to replace one of your morning coffees with one of these circulation-boosting beverages? While the drinks above are beneficial, seniors need to consider several factors to ensure maximum safety and effectiveness. A. Drug interactions. This is the most critical consideration. Some herbs or supplements can interact with prescription medications. Seniors are taking for chronic conditions, e.g., blood thinners, blood pressure medication, diabetes drugs. Example: ginger, garlic, or certain teas can potentiate the effects of anticoagulants, increasing the risk of bleeding. Recommendation: always consult your doctor or pharmacist before adding any new herbal beverage to your daily diet, especially if you are taking medication. B. Sugar content. Many packaged fruit juices or processed drinks have very high sugar content. Excess sugar not only causes weight gain and diabetes, but also causes inflammation and damage to blood vessels, worsening poor circulation. Recommendation: prioritize fresh, homemade juices with no added sugar. If buying packaged products, check the labels carefully. C. Caffeine content. Green tea and coffee contain caffeine. While caffeine can improve short-term blood flow, too much caffeine can cause dehydration, increase heart rate, and lead to anxiety, particularly in sensitive older adults. Recommendation: use in moderation, no more than 2 to 3 cups daily. If sensitive, choose decaf versions or caffeine-free herbal teas. D. Total fluid intake. Do not completely replace plain water with other beverages. Water remains the most essential fluid. Recommendation: ensure adequate plain water intake interspersed with circulation-boosting drinks. Interactive question 3. Besides the points mentioned above, do you have any other concerns about adding new beverages to your diet? How do you ensure safety when trying new approaches? Beverages are only one part of the bigger picture. To achieve maximum circulatory improvement, they must be combined with a comprehensive, healthy lifestyle. 1. Regular physical activity. Brisk walking, swimming, gentle cycling, just 30 minutes a day, 5 days a week, can make a huge difference. Exercise helps the heart pump blood more efficiently and keeps blood vessels elastic. Yoga, Tai Chi, helps improve flexibility, balance, and reduces stress, indirectly supporting circulation. 2. Balanced diet rich in leafy greens and fruits. Provides antioxidants, vitamins, and minerals. Limit processed foods, deep-fried items, saturated and trans fats. Helps prevent atherosclerosis. Eat enough fiber. Helps lower cholesterol and maintain gut health. 3. Maintain a healthy weight. Being overweight or obese puts strain on the circulatory system, worsening poor circulation. 4. Stop smoking. Smoking is one of the leading causes of blood vessel damage and circulatory impairment. 5. Stress management. Stress can cause blood vessels to constrict. Relaxation techniques like meditation, deep breathing, and listening to music can help. 6. Elevate legs. During rest, helps blood flow more easily from the legs back to the heart, reducing swelling, edema. Interactive question 4. What lifestyle changes have you already implemented to improve your overall health? Have you noticed those changes impacting your circulation? V. When to consult a doctor? While beverages and a healthy lifestyle can provide significant support, they cannot replace professional medical diagnosis and treatment. You should seek medical attention if you experience the following symptoms: severe leg pain, especially when walking, claudication. Wounds on the legs or feet that heal slowly. Changes in skin color, pale, bluish. Or temperature, unusual coldness in the limbs. Persistent, non-reducing swelling. Sudden numbness or muscle weakness. A family history of cardiovascular disease, diabetes, or high blood pressure. These could be signs of more serious conditions such as peripheral artery disease, PAD, deep vein thrombosis, DVT, or other cardiac issues requiring prompt medical intervention. Poor blood circulation is not an inevitable part of aging. By incorporating simple, golden drinks into your daily routine and maintaining an active lifestyle, you can significantly improve your circulatory health. Remember, every small step you take today is a major investment in your independence, energy, and quality of life for the years to come. Don't hesitate. Start today. After reading this article, which drink will you choose to start your circulation improvement journey with? Share your choice and why. Would you encourage someone in your family or a friend to try these methods? If so, what would you say to convince them? Imagine 1 year from now, if your circulation has significantly improved. What activity would you like to do that you currently find difficult? E.g., long walks, dancing, playing with grandchildren.